Today we're going to talk about sling use after shoulder surgery. When you wake up from surgery, you'll have a sling placed on your shoulder to keep it immobilized and protect the soft tissue while it's healing after surgery. But a couple times a day, you're going to have to remove your sling to shower and also to do your exercises. So we wanted to go through a quick video to show you how to take the sling on and off and to fit it or adjust it so that it fits you properly and you're wearing it appropriately and it's comfortable.
Hey, hi, my name is Jesse. I'm going to be putting on a sling to you after your shoulder surgery. We're going to properly fit it on you. And so what we're going to do is I'm going to have you place your arm right in here. Do me a favor, hold on to this part right here. It is in a normal position, so go ahead and take a deep breath, let it out. Good, and just relax your shoulders. This is where we want to have it at all times. I'm going to put this strap here, and this is going to keep your hand from moving forward and keeps your elbow tucked into space. Go ahead and stand up and lean forward just a little bit. We're going to place this right underneath there. Now what I'm going to do is I'm going to put this ball right in front of you. What you want to do is you want to just go ahead and put your palm right around that ball. And what you're going to do is you're going to be squeezing that, and that'll help with circulation. And make sure we're all set, and it seems okay. And we are ready to go.
Now that you know how to put on a sling and adjust the straps so that it fits appropriately and is comfortable, let's talk about a few exercises that you can do safely after surgery to improve your range of motion and make sure that you don't get too stiff. After surgery, it's important to wear the sling so that your soft tissues are allowed to heal, but it's also important to do a couple of these safe exercises so that you don't get too stiff. Most likely you'll be wearing a sling between 4 and 6 weeks. We'll go through a few exercises today that you can do during those 6 weeks where you'll be wearing a sling so that you can improve your range of motion safely while your shoulder's healing. You'll take the sling off daily to shower as well as to do these exercises. You can also take the sling off while you do the exercises with therapy. So we'll go through a few of these exercises now to work on your elbow and shoulder range of motion. First thing we'll talk about is working on your elbow range of motion. With our patient here, having had a right shoulder surgery, he will have the sling off and he will use his left hand to support his wrist, and he will use that hand to go into full extension and into full elbow flexion to go through passive range of motion. And you will do that using your other hand so that you're not firing the muscles of your surgery, of the shoulder that you had surgery on. And you could do this for 20 or 30 seconds, rest, let the muscles relax, and restart. You should go through a full range of motion, not just the range where it's comfortable. So you need to go where your elbow is all the way straight and to where your elbow is all the way bent. Now we'll go into the second exercise, which we have a group of 3 exercises to work on what we call passive shoulder range of motion exercises. The first one we'll do that you can do sitting at a table, where you place your hand up on the table and straighten your elbow out all the way. And now you'll use your legs to push away from the table and slide backwards as you're leaning forward with your chest towards your knees. And this will allow you to passively elevate your arm overhead without firing the muscles of your shoulder. You can do this easily with a wheeled chair. If you don't have a wheeled chair, then you can just slide your hand across the table while your chair stays still. And just do this to the point of comfort. The first 6 weeks, really all you need to do is get your arm up to about 90 degrees. And so if you're doing these exercises, getting to that point of motion, then you're going to do very well, and that's plenty of motion early on. The next exercise we'll talk about is doing what we call wall walks. And we'll stand up and we'll face the wall. And you can use your other hand to get your hand to the wall. And then you're going to use your fingers to crawl your fingers up the wall. And again, for most shoulder surgeries, we really only want you to get to about 90 degrees, which is about shoulder level. There are some exercises where I will specifically tell you that you can work to get full range of motion if that's appropriate for your surgery. So we're going to talk about our 4th exercise to work on for shoulder range of motion after surgery. And these are called pendulum exercises. All you have to do with your non-operative arm is support yourself against a table or a bed and lean forward so that your back is about flat to the ground, and let the operative arm just dangle free. And what you're essentially trying to do now is move your chest side to side and let your arm stay totally relaxed, and just swing your arm around in a circle to loosen the capsule and to get early passive range of motion. Hopefully these things will set you up for success after your shoulder surgery. Please give us a call at the number below if you have any questions or we can support you at all in your recovery after shoulder surgery.